it's Dr. Gambhir. I wanted to talk to you a little bit about the differences between Sculptra and dermal fillers. Dermal fillers are gels that can be placed underneath the skin. They come in varying thicknesses and they help either to push out a particular line or fold, enhance a lip area. They can be used to lift a cheek a little bit or contour a cheekbone. So they're really sculpting gels, basically, and these sculpting gels have different properties to them which suit different parts of the face. Sculptra is something very different. Sculptra is a stimulant. It forces the body to make collagen where you put it. Sculptra technically is known as poly-L-lactic acid. If you've ever heard of suture material would self-dissolve, so kind of if we have a wound, we stitch up that wound. And if we don't want to take those stitches out, we can use stitches that will self-dissolve over the next few weeks. If we take that self-dissolving stitch material and crush it into a powder, that's really what Sculptra is. Because we can't inject that powder into the skin, we mix it with a little bit of salt water, and we inject that powder suspended in salt water into an area such as a cheek. Once it gets into the cheek, it acts like scaffolding. The body starts to build collagen around each of those little particles. And that collagen building process will take 4 to 6 weeks. And once that collagen is built, typically by 4 to 6 weeks, the actual Sculptra, the poly-L-lactic acid or the dissolvable suture material is gone. So what you're left with is the raw collagen in that area. Collagen building is not immediate. So if I put a little bit of Sculptra in, I'm only going to know how the face reacts in 4 to 6 weeks. So you have to be careful not to overdo it. We're not seeing results in real time. So using a little bit of Sculptra, coming back in 4 to 6 weeks and adding more. For patients who don't need a lot of volume, even doing what we call half doses of Sculptra to start with, to make sure they're not developing collagen really quickly. For people who are incredibly volume depleted, sometimes you can start a little bit more aggressively. But generally starting slowly with Sculptra and having patience, sometimes between 2 to 8 months to build up the full result. And then those results are going to last 2 to 3 years. You're going to need some touch-ups as that Sculptra wears away. So doing touch-ups on average maybe twice a year or so is going to be a good thing. Sculptra can be used in many parts of the face, but the most popular and I think the safest area to use it is in the mid-cheek. And that cheek area tends to lose volume as we age. The Sculptra helps to lift that up and to minimizing the effect of gelling. If you put it too close to the surface of the skin, there's a chance you can get lumps or bumps, which are essentially collagen lumps or bumps. And they really don't go away for 2 to 3 years. So the use of Sculptra has to be done incredibly carefully and in skilled hands. Sculptra can be done in the temple area as well. It can be done in the folds and sometimes in other areas, but the risk profile for nodule development goes up. So it's an incredibly powerful and frankly unique tool that complements the use of fillers. For example, in a face that's aging, we may want to use Sculptra to create more lift in the mid-cheek. And then if we need a little contouring, we could use a filler of the right variety to create a little bit more contour of the cheekbone or the jawline or a teeny bit of lip enhancement. But these two things go together, but Sculptra and fillers truly are very different things, and always consult with your provider and to learn much more about Sculptra. Thanks for listening.